Depression. Depression is more than feeling sad for a few days. It is a mental health condition that can make everyday life feel heavy, even when nothing seems obviously wrong. People with depression often lose interest in activities they once enjoyed, struggle to find motivation, and may feel empty, hopeless, or emotionally numb. Sleep, appetite, and energy levels can all change, making even simple tasks difficult. Depression can develop after stressful life events, but it can also appear without a clear reason. Genetics, brain chemistry, physical health, and life experiences all play a role. It matters because it affects relationships, work, education, and physical health, yet with therapy, medication, lifestyle changes, or a combination of treatments, many people improve and regain a sense of purpose. Anxiety. Anxiety is the body's natural response to danger, but it becomes a disorder when fear and worry stay intense even without a real threat. Instead of helping someone stay alert, anxiety can constantly signal that something is wrong. People may experience racing thoughts, restlessness, muscle tension, trouble concentrating, or a fast heartbeat. Everyday situations can start to feel overwhelming, even when they are safe. Anxiety disorders are among the most common mental health conditions in the world, and they often begin during childhood or early adulthood. While occasional anxiety is normal, chronic anxiety can interfere with work, school, and personal relationships if left untreated. ADHD, attention deficit/hyperactivity disorder, commonly called ADHD, affects how the brain manages attention, impulses, and activity levels. Some people mainly struggle to stay focused, while others are more impulsive or physically restless. Many experience a combination of both. ADHD is not caused by laziness or a lack of discipline. Research shows that it is linked to differences in brain development and genetics. Children with ADHD may have difficulty following instructions or sitting still, while adults often struggle with organization, time management, and completing tasks. At the same time, many people with ADHD are highly creative, energetic, and capable of intense focus on activities that capture their interest. OCD. Obsessive-compulsive disorder is often misunderstood as simply liking things neat or organized. In reality, it involves unwanted thoughts called obsessions and repetitive behaviors known as compulsions. A person may constantly fear contamination, worry about causing harm, or feel driven to check, count, or clean repeatedly. These actions are usually performed to reduce anxiety, but the relief is temporary, creating a difficult cycle. Most people with OCD recognize that their fears are excessive, yet resisting the compulsions can feel almost impossible. Modern treatments, especially specific forms of therapy and medication, have helped many people gain control over these symptoms. PTSD. Post-traumatic stress disorder can develop after someone experiences or witnesses a deeply traumatic event. This could include war, serious accidents, natural disasters, violence, or abuse. While many people gradually recover after trauma, PTSD causes the brain to remain in a constant state of alert. Flashbacks, nightmares, emotional numbness, and avoiding reminders of the event are common symptoms. Small sounds, places, or even certain smells may trigger intense emotional reactions. Once mostly associated with soldiers returning from combat, PTSD is now recognized as a condition that can affect anyone who has lived through overwhelming trauma. Early support and proper treatment can greatly improve recovery. Bipolar disorder. Bipolar disorder is marked by significant shifts in mood, energy, and activity levels. These changes go far beyond normal emotional ups and downs. During depressive episodes, a person may feel exhausted, hopeless, and lose interest in daily life. During manic or hypomanic episodes, they may feel unusually energetic, confident, talkative, or impulsive. Some people sleep very little during these periods without feeling tired. These mood episodes can last for days, weeks, or even longer, and they can affect judgment, finances, relationships, and safety. Bipolar disorder is a lifelong condition, but with proper treatment and support, many people manage it successfully and lead stable lives. Panic disorder. Panic disorder involves repeated panic attacks that happen unexpectedly and are often followed by a constant fear of having another one. A panic attack can begin suddenly, causing a pounding heart, chest pain, dizziness, shaking, shortness of breath, and an overwhelming feeling that something terrible is happening. Many people believe they are having a heart attack during their first episode. Because these attacks are so frightening, some begin avoiding places or situations where previous attacks occurred. Over time, this fear can become just as limiting as the attacks themselves. Understanding the condition and receiving appropriate treatment often helps reduce both the attacks and the fear surrounding them. Social anxiety disorder. Social anxiety disorder is much more than simple shyness. It is an intense fear of being judged, embarrassed, or rejected during social situations. Speaking in front of others, meeting new people, eating in public, or even making eye contact may cause overwhelming anxiety. People with this condition often know that their fears are stronger than the actual situation, but that awareness does not make the anxiety disappear. Many avoid social events altogether, which can lead to loneliness and missed opportunities in school, work, and relationships. With therapy and practice, many individuals gradually build confidence and reduce their fear. Eating disorders. Eating disorders are serious mental health conditions that affect a person's relationship with food, body image, and self-worth. They include disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder. Although each condition is different, they often involve unhealthy eating behaviors driven by emotional distress rather than hunger alone. Social pressure, genetics, personality traits, and psychological factors may all contribute. These disorders can cause severe physical complications, including heart problems, malnutrition, and damage to many organs. Recovery usually requires both medical care and psychological treatment because the illness affects both the mind and the body. Personality disorders. Personality disorders involve long-lasting patterns of thinking, feeling, and behaving that differ greatly from what is generally expected within a person's culture. These patterns usually begin during adolescence or early adulthood and can make relationships, work, and daily life much more difficult. There are several different personality disorders, each with unique characteristics. Some involve emotional instability, others create deep distrust of people, while some lead to extreme perfectionism or social withdrawal. These patterns are not simply personality quirks. They are deeply rooted ways of experiencing the world that often develop through a combination of genetics, early life experiences, and environment. Therapy can help many people develop healthier ways of relating to themselves and others. Schizophrenia. Schizophrenia is a complex mental disorder that affects how a person thinks, perceives reality, and interacts with the world. Some people experience hallucinations, such as hearing voices that are not actually there, while others develop false beliefs known as delusions. Thoughts may become disorganized, making communication difficult. Many also experience reduced emotional expression and a loss of motivation. Schizophrenia does not mean someone has multiple personalities, despite a common misconception. It usually begins in late adolescence or early adulthood and requires long-term treatment. Medication, therapy, family support, and community care have greatly improved the outlook for many people living with the condition. Dissociative Identity Disorder. Dissociative Identity Disorder, often called DID, is one of the least understood mental health conditions. It involves the presence of two or more distinct identity states that may take control of a person's behavior at different times. The condition is strongly linked to severe and repeated childhood trauma, where dissociation becomes a way for the mind to cope with experiences that are too overwhelming to process. Memory gaps between identity states are common, and daily life can become confusing and stressful. Popular movies often portray DID as dramatic or violent, but real cases are usually far more complex and deeply connected to survival after trauma. Treatment focuses on safety, stability, processing traumatic memories, and helping the different parts of a person's identity work together more effectively.